Iron deficiency anemia. Iron deficiency anemia. That's the topic for this session. Iron deficiency anemia is the type of anemia which arises from the lack of iron in the body. The average person, that's a man who weighs about 70 kilograms, has 3.5 to 4 grams of iron in their body. This implies that for every kilogram of the body, there is 50 to 60 milligrams of iron. About 65 to 70% of iron in the body is found in red blood cells, specifically in hemoglobin. Some of the iron is also found in muscles, where they are located in myoglobin. Some are also stored as ferritin or hemosiderin in the liver, spleen, and bone marrow. Some iron is also bound to transferrin and circulates in the plasma of the blood. The rest of the iron are also found in enzymes and cytochromes of body tissues. Sources of iron in the diet is mainly from animal foods, that's meat, such as beef, chicken, and pork. Dark green leafy vegetables also contain iron. For example, cocoyam leaves, which is commonly called kontomire in Ghana, and ayoyo. Iron in animal foods are easily absorbed than plant foods. So iron in meat or animal foods is called heme iron because they are bound to heme. This makes them easily absorbed. Iron in plant products are also called non-heme iron. They are not bound to heme. Iron is the most abundant element in the earth. About 35% of the mass of the earth is iron. Despite this high abundance of iron in the earth, iron deficiency anemia remains the commonest cause of anemia in the world. Several factors account for this, but one of them is the fact that plants are not able to absorb much iron from soil because iron in the soil is bound to other compounds and are not easily absorbed by plants. Also, the iron in the food that we eat is not easily absorbed. Just about 2 to 10% of iron in plant foods are absorbed in the digestive system. About 15 to 35% of iron in animal foods are also absorbed in the digestive system. This is to regulate the amount of iron in the body so that there is not excessive levels of iron in the body, because excess amount of iron in the body is toxic to the body systems. Iron deficiency anemia accounts for 50% of all anemias. That's half of all anemias is iron deficiency anemia. And it is also estimated that about 500 million people or more in the world have iron deficiency anemia. Clinical presentation of iron deficiency anemia. The clinical presentation are the signs and symptoms that show that a person is likely to have iron deficiency anemia. So we have one, the general signs and symptoms of anemia. The general signs and symptoms of anemia are also present in iron deficiency anemia, and they include pallor, that's paleness, dizziness, breathlessness, fatigue, headache, insomnia. These are all non-specific signs and symptoms which are also in iron deficiency anemia. Then two, we have specific signs and symptoms which are related to iron deficiency anemia. So the first one is brittle and spoon-shaped nails, which is called koilonychia. I'll show pictures very soon. Then 2, there may also be sores or cracks at the corners of the mouth, and this is called angular cheilitis. Some also call it angular stomatitis. Then 3, we have atrophic glossitis, that's smooth and sore tongue. Then the 4th specific sign related to iron deficiency anemia is a strong desire to eat substances which do not have any nutritional value, and it's called pica. So persons with iron deficiency anemia tend to enjoy eating non-food substances like charcoal, clay, and ice. Iron deficiency anemia can also cause cognitive impairment in children. They may have learning difficulties and difficulties paying attention and even memory. Iron deficiency anemia can also result in developmental delays in children. So, in summary, the clinical presentation of iron deficiency anemia, the general signs and symptoms of anemia, that's pallor, dizziness, breathlessness, and fatigue. Then 2, the specific signs and symptoms of iron deficiency anemia, which include brittle and spoon-shaped nails, that's koilonychia, sores at the corners of the mouth, angular cheilitis, atrophic glossitis, that's smooth and sore tongue, and then pica, strong desire to eat substances which are not food. Then the 3rd major symptom of iron deficiency anemia is cognitive impairment and developmental delays, especially in children. So this is a picture of koilonychia. This is a picture of koilonychia, as the surface of the fingernail becomes concave. This is due to deficiency of iron, which impairs formation of keratin in the fingernails. This is angular cheilitis or angular stomatitis, sores or cracks at the corners of the mouth due to iron deficiency anemia. Causes of iron deficiency anemia. There are 4 major causes of iron deficiency anemia. These are: number 1, loss of blood or blood loss, which is also known as hemorrhage. Then 2, increased demand for iron. 3, malabsorption or difficulties in absorbing iron. And then number 4, poor diet that is deficient in iron. So let's take them one after the other. Blood loss. Blood loss can arise from bleeding from any part of the body, and this includes excessive menstrual bleeding, which is called menorrhagia, and bleeding into the gastrointestinal tract due to parasitic infection, especially hookworm, and hemorrhoids or ulcerative colitis or cancer in the GI tract. Then, second cause of iron deficiency anemia, increased demand for iron. There are certain conditions which places high demand of iron on the body, such as pregnancy, lactation, menstruation, and even in growing children. So if the supply of iron is not able to meet the demand, iron deficiency anemia will ensue. The third cause of iron deficiency anemia is malabsorption. This can result from gastritis or gastrectomy. Gastritis is inflammation of the lining of the stomach, and gastrectomy is surgical removal of part of the stomach, and these can all impair the production of hydrochloric acid in the stomach, and hydrochloric acid provides acidic environment which accelerates the absorption of iron. And celiac disease can also cause malabsorption. Celiac disease is an autoimmune disorder which results from eating gluten. Gluten is a type of protein that is found in some foods such as wheat and barley, and some people are not comfortable eating gluten. Their body responds by producing autoantibodies whenever they take gluten, and this can destroy the lining of their GI tract, the gastrointestinal tract, especially the duodenum and even the stomach lining, and this impairs absorption of iron. The fourth cause of iron deficiency anemia is poor diet. That's diets which are deficient in iron. So diets that is mostly based on plant foods with little animal protein tend to cause iron deficiency anemia. Because one, diet based on mainly plant foods have non-heme iron which is not easily absorbed. Secondly, there are some substances such as phytates in cereals which also impair the absorption of iron, and tannins also impair the absorption of iron. Laboratory investigation of iron deficiency anemia. There are several tests which can be performed in the laboratory to demonstrate the presence of iron deficiency anemia in a patient. So we have the screening tests, which include full blood count and blood film comment. We also have iron profile, and this includes measurement of certain parameters that are related to iron. So under iron profile, we have serum iron, serum transferrin, total iron binding capacity, transferrin saturation, and ferritin. Then we also have bone marrow aspirate examination. This is a very invasive procedure and is not usually done except in difficult conditions, in severe iron deficiency anemia, and where diagnosis is even difficult to establish. Other supportive tests that can also be done to ascertain iron deficiency anemia are stool examination for parasites, especially hookworm, and even occult blood tests to demonstrate bleeding in the GI tract. Endoscopy and bladder examination are all done to detect bleeding that can cause iron deficiency anemia. So let's look at the laboratory findings. So let's review the laboratory findings that are associated with iron deficiency anemia. So the first one is full blood count. In iron deficiency anemia, the HB or hemoglobin level will be low because iron is needed in the formation of hemoglobin. It's an integral part of hemoglobin. So when there's deficient supply of iron for the formation of red cells or hemoglobin, the hemoglobin level reduces. Then low mean cell volume. The MCV will be low in iron deficiency anemia because the cytoplasm of the cell is composed of hemoglobin, and iron is also part of hemoglobin. So if iron is deficient, the cytoplasm of the red blood cell cannot form its normal size. Therefore, it becomes smaller. Then low mean cell hemoglobin. If iron is deficient, the amount of hemoglobin reduces, and then the mean cell hemoglobin also reduces. Then to high RDW. RDW is red cell distribution weight. In iron deficiency anemia, the red cell distribution weight tends to increase. In fact, it is the first sign of iron deficiency anemia. This is because as iron deficiency anemia progresses, some of the cells will lack iron to become the normal size and therefore become smaller, while the cells which were produced when iron was abundant will also have the normal size. So we have a lot of small red cells and big red cells. That's microcytic and then pneumocytic red cells, and that accounts for the high RDW. So that's it for the full blood count. Then reticulocyte count is decreased in iron deficiency anemia. The formation of red blood cells in the bone marrow is called erythropoiesis. And red cells go through a lot of series of developmental stages, but the last but one stage before it matures to become red blood cell is called reticulocyte. And iron deficiency anemia, because erythropoiesis is impaired, the reticulocyte count decreases. Then 3, blood film comment. In iron deficiency anemia, the blood film comment is usually microcytic hypochromic. Microcytic means the red cells have smaller size, and the hypochromic means the hemoglobin content of the red cell is low. Therefore, the central portion of the red cell is increased in size. You will see pictures very soon. So hypochromic, hemoglobin level is low in the red cells. Therefore, the central pallor, which is the hollow center of the red cells, is increased in size because of decreased hemoglobin levels at the periphery of the red cells. Then anisocytosis, as I mentioned under the full blood count, is also present in blood film comment. Then some poikilocytes, abnormal shaped cells, are also present in blood film comment, and these include elliptocytes and target cells, and most importantly, pencil-shaped cells. So this is a picture of normal blood film. This is a normal blood film. These are the red cells. This is a red cell. These are all red cells. And in the normal blood film, we can see that the central pallor is about 1/3 the size of the red cells. The central pallor means the center is pale. Pale is the noun form of pallor. So the noun form of pale is pallor. So central pallor, central paleness. The center of the red cell are pale because most animal cells have nucleus. So the red cells during its earlier developmental stages has nucleus, but as it matures and is released into the peripheral blood, the nucleus is taken from the center of the red cell, and that creates a hollow space, which is called the central pallor. These are platelets. The small purple ones are platelets. This is a platelet, this is a platelet. And then these two cells are white blood cells, specifically neutrophils. This is a matured neutrophil or segmented neutrophil with 3 segments or loops. This is a band neutrophil because the nucleus looks like a band. It is horseshoe shaped. It's a band neutrophil. This is blood film in iron deficiency anemia. So compared to the normal blood film, the central pallor of the red cells have increased in size, and therefore they are hypochromic. So the central pallor have increased in size. So they are therefore hypochromic. The red cells are also relatively smaller compared to the normal blood film, so they are microcytic. In order to determine whether a red cell is of normal size or smaller size or bigger size, it is compared to the nucleus of a small lymphocyte. And we shall see this in subsequent videos. If the red cell is the same size as the nucleus of the small lymphocyte, it is monocytic. If it is smaller than the nucleus of the small lymphocyte, it is microcytic. And if it is bigger than the nucleus of the small lymphocyte, it is macrocytic. These are also poikilocytes. This is a pencil-shaped cell. It looks like a pencil-shaped cell. This is an elliptocyte. Elliptocytes are also present, and this is a teardrop cell. So sometimes teardrop cells can also be present in iron deficiency anemia. So pencil-shaped cell, elliptocyte, and then teardrop cell. This is another picture of blood film in iron deficiency anemia. Blood film comment is not always cast in stone. Sometimes the same condition can present with slightly different findings from one patient to another. So you may have two patients with iron deficiency anemia, but the blood films may be slightly different. So this is another one. Cells are hypochromic and microcytic, and elliptocytes are also present. So this is an elliptocyte. This is an elliptocyte. So let's continue with the laboratory findings. We've done full blood count, we've done blood film comment. We are now on iron profile. So under the iron profile, serum iron is decreased in iron deficiency anemia. Because iron is deficient in the body, serum iron will decrease. Then serum ferritin is also decreased in iron deficiency anemia. However, under inflammatory conditions or in infection, serum ferritin can be normal or increased, even though there may be iron deficiency anemia, because serum ferritin is an acute phase protein, and its level is increased in inflammatory or infectious conditions. However, most of the time in iron deficiency anemia, serum level is decreased. Then transferrin saturation is also decreased in iron deficiency anemia. Transferrin is a protein which transports iron in the blood. So if iron is deficient, the amount of transferrin that is bound to iron will decrease. Therefore, transferrin saturation is decreased in iron deficiency anemia. Then lastly, total iron binding capacity, which is a measure of the ability or the capacity of transferrin to bind iron. In iron deficiency anemia, since the level of iron is low, only a small proportion of transferrin is bound to iron. Therefore, it has capacity to bind more iron. Therefore, total iron binding capacity is increased in iron deficiency anemia. So, as a summary, in iron deficiency anemia under iron profile, serum iron is decreased, serum ferritin decreased, serum transferrin is decreased, whereas only total iron binding capacity is increased. So all the parameters are decreased except total iron binding capacity, which is increased. So treatment of iron deficiency anemia. The treatment of iron deficiency anemia is based on two major principles. The first one is to identify the cause of the iron deficiency anemia. For example, if there is bleeding, the bleeding must be stopped. Then two, iron supplementation is also done to replace the iron losses in the body. So this can be done by giving oral iron supplements. And in situations where oral iron supplements is not tolerated by the patient, parenteral iron in the form of intramuscular or intravenous injections can be given. Thank you very much for watching this video, and these are the references. Bye bye.